I'm Dr. Wesley Barry. I'm going to talk with you briefly about so-called AV access surgery. That is arteriovenous access surgery. If you are here for this reason, that means pretty soon you may be a patient that would be dependent on getting your kidneys cleansed 3 times a week by way of what's called a dialysis machine. That's very important, of course, for life to continue. What I do as a surgeon is create a pathway by which you can be connected to that machine, and that's called an AV access. There are basically 2 types of AV access. The one that we'd like to be able to create in every patient is when I take your own vein of your arm and take your own artery and connect those 2 together. The arterial blood runs through that vein, enlarges it, and that way they're able to puncture that vein and access you and put you onto the dialysis machine. However, in many patients, more than half of the patients, they don't have veins that are acceptable to be used in that way. For those patients, we create an access using a man-made tube or graft where we connect the artery to the vein, still tunneled under the skin. The advantage of doing it without a graft is that there's much less chance for infection. It will last much longer before it would clot. There are fewer reoperations. I want you to understand, if we get a good AV access that is just without a graft, the chances of us having to do anything else to it are minimized. If we have to use a graft, most grafts will only last for about 6 to 8 months before we'll have to do something else to keep it going. And with grafts, we monitor them as we do access every 3 to 4 months with ultrasound to try to tell if and when a problem is developing, either with the blood coming in or the blood going out of the access. If we see that, we're able to do things like using balloons from the inside to open up those areas and prevent you having to have another major procedure. AV access is a long and complex and very involved field. It is a way to keep you going. It is your lifeline. It's something that we have to do. It's something that has to be done. Everybody's anatomy is different. I will assess and have your veins assessed by ultrasound technique to see what opportunity I'd have to establish the very best access in you. And I promise I'll do everything I can to keep your lifeline going. Thanks for allowing me to be your access surgeon.